Some of the stereotypes of men are that men are supposed to be strong both mentally and physically, or men don't cry or feel pain. But do you know Martin Armstrong from Statista report titled Suicide Rate Around the World, released in November 2019, states that in 2016, the number of men suicide were much higher than in women. As we can see in this graph, we can see that the number of men committing suicide is much more higher than in women. Now, suicide is a major problem in our society because it takes lives of people and also gives an insight about the society that we live in. Suicide, an article by Our World in Data by Hannah states that globally 800,000 people will commit suicide per year. Suicide is such a problem which can affect any person at any level of Maslow's hierarchy of need. That means that any person on the hierarchy will possibly commit suicide. In India, a student will commit suicide every hour. If suicide statistic, an article from May 2020 from American Foundation for Suicide Prevention data were to compare to Wartburg, then out of 1,500 students, 132 students will commit suicide every day. I've done extensive research on this issue and I'm credible to talk about this issue. We will then look at some cultural context about suicide, what are the causes, and some possible solutions for this problem. We will now look at the problem. Suicide is a taboo in many countries and in many cultures. Suicide carries a social and moral meaning in most of the societies. At both the individual and population levels, the suicide rate has long been understood to correlate with cultural, social, political, and economic forces, according to NCBI in 2002 from the book Reducing Suicide. Many a times, doctors and nurses have negative attitudes towards patients who have attempted suicide. Research evidence has indicated that unfavorable attitudes among doctors and nurses exist towards attempt suicide patients, which have a negative impact upon the quality of care that is provided to them, which was founded by Christina Ozuna and Konstantinos in Health Science Journal on March 2015. Unlike US culture as a whole, Asian cultures condone and accept the practice of suicide as legitimate in context of familial shame, interpersonal conflict, and for altruistic reasons, says Bhatia on Psychiatry Advisor titled Suicide Prevention and Intervention. She continues to state that when informed of a death by suicide, Asians are more likely to say it is understandable. Now we will look at a graph of US and suicide. From 1999 to 2016, we can see Iowa's suicide rate has increased from 31% to 37%. Next, we will also look at the correlationship between economic level and suicide by age. As we can see, the blue, which is high economic countries, and pink, which is the low and middle economic countries. We can see that the rate of suicide in low and middle economic country is higher. We will now look at the causes for suicide or why people commit suicide. There are many causes. One of the causes is mental illness. Suicide is not a mental illness, but is caused by mental illnesses such as depression, bipolar disorder, schizophrenia, and substance abuse. According to Suicide, Schizophrenia, and Bipolar, an article published by Mental Illness Policy on Jan 2019. Depression is one of the leading causes of suicide. Now, some environmental factors. According to risk factor and warning signs published in Jan 2020 by American Foundation for Suicide Prevention, states that access to lethal means, including fire and drugs, can trigger a person to commit suicide. prolonged stress, stressful life events, exposure to another person's suicide or to graphic or sensationalized accounts of suicide can push a person to commit suicide. According to Children's Hospital website by Boston Children's Hospital titled Suicide in Teens and Children Symptoms and Causes, some other reasons for a person committing suicide are physical, sexual abuse, loss, poor coping skills, etc. There are some historical causes too. According to risk factor and warning sign published by American Foundation for Suicide Prevention in Jan 2020 states that some of the factors of committing suicide are previous suicide attempts, family history of suicide, and childhood abuse, neglect, or trauma. Now, we will look at some of the methods that people use to commit suicide. As we can see, firearms is at 55%, which is the majority. We can now look at the possible solutions for prevention of suicide. Now we need to understand that suicide is a serious and complicated problem, so the effectiveness of the treatment may vary. These are the possible solutions according to Mayo Clinic's article Suicide and Suicidal Thoughts, released in October 2018. What can a person do to support a person who commits suicide, who is trying to commit suicide? First, establish a support network. Second, look for signs or suicidal thoughts slash actions when spending time with the person. What can a person who feels suicidal can do? Treatment is available. And remember, suicidal thoughts can be temporary. Again, suicide is a complicated situation because it differs from person to person. We can we do not always know the cause and possible solution for suicide. Today, I shared about suicide, some of the causes of suicide, and some of the ways we can prevent it. Remember, keep your eyes and ears open and look for sign of suicidal thoughts or action in a person. Try to support them in all means possible. If you or someone you know feels suicidal, you don't have to help on your own. Counseling through pathways or suicide helplines are available on local and national scale. Remember that suicide is not the solution, but if we work together, we can put an end to the problem.